Hello, everyone. How are you all doing today? If you guys want, you can switch on the camera and if you're all comfortable, okay? Switch on the camera. Hi, Jill. Hi, Rishabh. Rishabh at gym. Very dedicated. Good. Exercise is very important, right, guys? And few people are driving. Amazing. Okay, no problem. If you're not in a situation where you can switch on the camera, that's fine. But I like the way that you're interested for today's class. That's amazing. Okay. Yeah. Gain a weight during return, right? Right. Now, once you work as a resident PT, you will lose all the weight. Okay, guys. So myself, Vrunda Bhatt. I am one of the mentor and instructor for our StudyBuddy Clinical team. And we are teaching the OC since it started. It's more than now 6 or 7 years that we started teaching our clinical course when it was kind of in person, and then COVID happened and everything changed. And now the exam is online based. So we are offering course for the only Ontario clinical exam at this point. So today our agenda is um, a little bit discussion about how you can, prepare for your OC, some registration procedures, some questions you might have, right, before you start preparation for Ontario clinical exam or before you start working as a resident physio. A few maybe students, maybe not in Canada, they are in other countries. So you must have like a lot of questions for that. So we're going to discuss all that. I know few questions are like very common questions that we're going to discuss first, and then I will ask everyone opportunity to, ask your question. If you have a question, you can raise your hand, and then I will, let you speak. Don't speak all at the one time, otherwise it will be like, a little bit chaos. Okay. So before we start, do you guys, anybody has any question before we start our session today? So first of all, congratulations for who recently passed or who already passed the written exam. It's a really important milestone. And now the once you already jump and a little bit clear the base on OC will be a little bit easier. It's not the easy exam, I would say. It still check your skill and your how how safe physiotherapist you are, your skill they will check, your competency they will check, right? So it's a 3-hour interview based online exam. It's structured interview based exam, so it's a little bit different exam than written exam, right? In written you still have a chance to go back and fix your answer, but when you are speaking to somebody and talking to somebody, it's kind of a little bit challenging, I would say. So if you have a correct practice and proper study plan, then it's easy. It will be easy for you to pass this exam. But it's very important to understand the structure and how differently you need to prepare for this exam. So that's why we'll be discussing a little bit about that. We will be taking orientation class before our next batch starts, so it will be discussion about same, like more detail about OC. But today mainly like whatever questions you have after passing your written exam, like few students recently passed, right? So they must have like a lot of questions about it. So I will start a little bit information about it, and then if you have any question even in between, you can raise your hand and I will going to answer. Okay. Few students are still coming, so I'll keep adding them. And I'll check the chat box at the end. or in between as well. So if you're not comfortable asking question with switching on camera or like, raising the hand, you can also ask a question in the chat box. Okay. So first of all, our first step for registration is once you pass your exam, right? Then you will get email. This is for student like who didn't book OCE yet and they have like just passed the exam. Okay, so you will get email for congratulations. You will get like here you now you are now you are resident physio, not register, sorry. Now we are resident physio, right? That was correct. So then first step is you need to register for your Ontario clinical exam. Now the good thing is you can work as a resident physio. So before you start working as a resident physio, you have to register for it. So you have to go to the college website and then you have to register yourself. So when you go to the college website, there is a PT portal is there, like Ontario Clinic register for Ontario Clinical's website. If you can go college website, and then you can click on that. There will be a PT portal there. So once you go to the PT portal, it will be look like this, and this is site ptportal.college.org, and then this page will open, and then you can go to the OC application. And then there is a lot of forms. So it's like just basic information about you, and it's basic information. You have to fill that up. And then you can, the profile will open and you register for the OC exam. So you have to register for the OC exam in order to work as a resident physio. Okay. And then once you fill up the form, it will take 4 weeks to review your application. Once the application is reviewed, then you will get another email that, hey, it's reviewed, you can book your exam now. You can choose the date. They will give you date option. Whatever is earliest available, you will get that date. And you have to take, you don't have choice like, oh no, I want after 6 months. There is no choice. Whatever the first earliest date available, that you have to take it. And the fee structure is 1985 Canadian dollar. Okay. Then you will get like back to back a lot of emails that you have to proceed, and it's kind of very informative. You will not stuck anywhere, so no need to worry about anything. Once you pay the fees, you will get another email that we receive your payments, and then you need to choose your mentor to work as a resident physio. Then once you get the mentor, you need to add that information too in the PT portal, and then you can work as a resident physiotherapist. Okay. Then once you choose the date and pay the fees, they will give you a lot of another information about how to prepare OCE, blueprint. They will give you some informative videos. Make sure you watch that because those videos are very, very important, and they will tell you what are the basic requirement to start your technical requirement. I would say like whiteboard, proper internet, what kind of headphones you need to use. So those kind of technical requirement, as well as they will also demonstrate what are the questions look like and how the exam will look like. So very informative video. Even those video are there on the college website. So there are a lot of information available. So don't get confused. You no need to start asking a lot of questions to the friends, but educate yourself. Go to the college website and watch all these videos. That will be very, very helpful. So once you register your exam, choose your mentor, and you can start working as a resident physio. Okay. And then next step will be you have to start your preparation. So student who recently passed, everything is fresh in your brain, right? Those information will be very, very helpful. So don't take big gap after your PCE exam. Don't take like, 1 year gap and then I will take OCE. This will be big disadvantage. So take OC as soon as possible. So all this basic knowledge that you have for your written, you need to use for your clinical too, right? In clinical, they will ask more practical questions. Again, you don't need, it's an online exam, so you no need to demonstrate your hands-on skill, or they will not ask you like, show me how you can do shoulder mobilization, or show me how you will do transfer, right? You have to verbalize everything. And they will check how important, like whether you have knowledge and are you able to provide your critical thinking and reasoning about whatever your decision is. Okay, so you have to do assessment and treatment. They will provide the case scenarios of it, and then they will check your knowledge. So it's kind of, discussion kind of exam. So a little bit, I will not detail, but a little bit about OC exam. So exam is like a 3 hour long. Generally, like student will take 3 hours. Some students finish in early as well, but you will not get more than 3 hours. So time management is very, very important. A lot of students, they get indulged in giving like a lot of detailed questions. This exam is more like to the point, give only information which is needed, right? So that practice is important. Otherwise, you keep stretching the answer and then time will run. So exam is divided in part 1 and part 2. Part 1 is part 1 included two big case scenarios. One scenario will definitely MSK related. Another case scenario, either neuro, cardio, or other system. Okay, so MSK has a good weightage. So you will definitely get one case scenario related to MSK condition, musculoskeletal condition. Scenario is a little bit big scenario. We're going to show you like how this scenario looks like in our orientation class, and that will be free as well. So please join our orientation class as well. The part 1, the big case scenario, it will give you like a lot of detail about maybe subjective history, about social history, about work history, symptomatic history, and then you have to assess the client, or you have to organize your treatment plan, right? There are a lot of core questions that they would ask about like what are the appropriate physiotherapy treatment plan, what's your social determinants, what's your discharge plan, how you progress your treatment plan, those kind of core questions that definitely will be there. So those detailed question is also available on college website, so you can check that. So two big case scenario, part 1. Part 2 is only ethics, vignette style questions, right? Small vignette style questions. And then they will ask you some, core question and probing question. So what is probing question? So if I'm answering something and if my examiner has a doubt, like whether you really know that, they will stop you and ask you like, what do you mean by this? Why you think stretching exercise is important? Okay. How long the hold should be in any kind of stretching? Like those kind of in between, they stop you and ask you certain questions. That's a probing question to know your understanding and ability of your clinical reasoning. So a lot of students get stuck in that probing question. So we're going to practice those questions. Two examiner will be there. Why two examiner? Mostly like sometimes if there is any technical issue happen towards the one examiner, you will still have another examiner and exam will continue. Exam will be recorded for a future assessment as well. So it's very, very important for you to have good internet. Okay. So if you're not in Canada, you can still give this exam. If you're in India or any other province, you can still give this exam. A lot of students find that OC is much convenient and easy to pass than other provincial exam, which is like Alberta and British Columbia. They are still conducting in-person exam, right? So it's like more convenient because you will be giving this exam from your house, from your office, or anywhere like where you feel like silent and environment and good internet. So a lot of students even giving exam from their workplace. They just book one room and then they give the exam. Or you can also give from the home, but important thing is your internet should be good. Okay, so this is about OC exam. So part 1, part 2. Part 2 is ethics. There is 11 vignette question. Part 1, 2 big question, one definitely from MSK and another one from maybe cardio, neuro, or other system. Okay, so that's the whole exam that will be completed in 3 hours. Now, I'll discuss some question. Any question, guys, so far? So I have already aware about few questions that you might have. So we'll discuss that, and then I'll give opportunity for everybody to ask question if you still have, okay? Everything is okay so far, guys? Okay. It would be great if possible, you can switch on the camera. It's good to talk to the faces. Okay. So a lot of time the main question is, can I give exam from India or other country, right? So a lot of students prefer that, okay, let me go to the India in my home, like I have my mom cooking food, I will be study, right? So a lot of students prefer that. Yes, you can do that. Make sure time will be changed, right? You might be giving exam in early in the morning or maybe late night. So time difference will be there. So practice accordingly. Plus good internet connection should be there. Okay. There are some criteria that you have to follow for exam procedure, like they will be checking the environment. There should not be anybody in the room. So those are the criteria should be matched if you are even giving from India. So yes, you can give exam from anywhere, but your internet should be good. They recommend it's good if you give the exam in Canada because now you're resident PT. So it's good to work, having a work experience in Canada. So then the next question, can I able to pass my OC without any work experience in Canada? There are a lot of students, they pass that written, they are still in India. Now they are resident physio, but they want to come being a fully registered physio. So, they don't have any stress of, paying rent or anything. So there are a lot of students who pass the OCE even without working in Canada. They never worked in Canada, but still with the proper guidance and proper preparations, they can able to pass the exam. So definitely you no need to have there is no mandatory work experience need to be there that you have to work in Canada, but it's a beneficial if you will have like a plus point, like more clear vision if you are working here. So it's a good to work, not crazy like 40-50 hours, like, but at least work 3 to 4 days to have like an idea about how the patient question should be, how the consent should be taken. Like it's kind of a little bit different practice than our back home India practice. So working will be definitely helpful to understand about a lot of structure. Like the sometimes the client asks a question, we need to know like similar thing in our actual exam. A lot of ethics you will be learned when you start working over here, right? A lot of different setting that setup like hospital setup, outpatient setup, nursing home setup, and they have like a different criteria of working too, right? So it's important to know. But if you are not even working, we can still discuss that in our classes. That's why you are taking classes, right? And then you can still able to manage. Okay. Is OC is easy than another provincial exam like Alberta or BC? As I discussed before, I would not say it's completely easy that you have to, kind of easy peasy, but you will definitely judged and you will definitely score on your performance. You have to practice at least 3 months practice, I would say. With the study partner, it's not the exam that you sit down, open the books, read, and go for the exam. It's not like that because you have to speak for 3 hours. You have to practice speaking. At least 3 hours per day, you have to practice, I would say. And then if you're completely thorough with your basic, then you will not get you'll not have like a lot of reading stuff. But there are students like who passed written exam long time ago, they might need to refresh all that basic stuff, right? So more clinical stuff that you have to know. Any condition you need to know about how appropriately you will assessing and then treatment. For example, if I have a bicipital tendonitis, so you should know about the examination of bicipital tendonitis and what are the treatment for that. Okay, then you will have a like bunch of questions about social determinants, discharge criteria, when to progress the exercises, short-term and long-term goals, and all those questions will be there. But basically, treatment and examination, that's what we need to know. Red flags, you need to know your competency. You need to know that whether you can able to treat this patient or you have to refer it, right? So if it's not within your scope of practice, you will not treat that patient. So those are the important steps that you need to understand and that we're going to discuss in our classes. So it's convenient, I would say, not easy, but it's more convenient. Ontario clinical exam is more convenient compared to Alberta and BC. That's what our students said. And you can easily transfer your license to other province, right? So I would say go for OCE if possible. So let's check the chat box now if you have any questions so far. Can I apply for provincial license while waiting for exam date? Provincial license means for resident, working for resident physio, Sakar? Yes. Yeah. So that's what I explained in earlier. So once you get your written exam result, you have to apply for resident working as a resident physio, right? So for that application is only approved once you check once you get your exam date. So you can work, but you cannot use that number. So you have to wait for 4 weeks, I guess. Yeah, you have to wait for that 4 weeks, but you can still provide the services. But I think you cannot able to what it say, like generate the billing because you will get your number, right? Your register number. That what you need to know for billing. So you need to wait for 4 weeks. Can we change province if we give exam in particular province? Yes. If you are giving exam in Ontario and if you decided that it's a lot of cold and I want to go to BC, yes, you can go to BC. And then if you are there, if you want to come over here, if you have if you are done with the BC exam, you can also transfer your license to Ontario. So yes, you can easily. That's just the online procedure that you have to do. Again, you have to go to the PT portal and you have to change the provincial license from any province. So yes, you can change. What is the time frame after which we can do this? So once you get your full license, then you can you have to apply for the procedure. And I think within 4 to 6 weeks, depends on how much rush they have. Generally, they'll not take more than 4 to 6 weeks. Professional liability insurance, there are a lot of different companies. I am not promoting any company over here, but there are a lot of company that they are providing your liability insurance. That's also a very important thing to take before you start your practice, right? Yeah. You're welcome, Priyanshi. Okay, let's go ahead. How long is the ideal preparation time? So earlier is better, right? I would say start early, get familiar with the exam format, get familiar with the questions that they are asking. So earlier is better. Our course, they are giving same access for the 1 year, right? So definitely I don't recommend like wait more than 1 year because you will forget your basic stuff that you have already read for written exam. I would say 3 months. 3 months is more than enough to prepare for OC, intense preparation for 3 months. So we are taking live lectures for each and every, like in 1 year, we are taking live lectures for 4 times. So each and every exams, we are taking live lectures. So I would say if you can join early before your exam, for example, if you are going for March. Okay, if you're going for March, our classes will be started from December. Okay, so December, January, February. So 3 months is the plan that you really need to work. So you'll be taking classes then followed by mentorship, and then followed by mock, right? So it's kind of 3 months preparation time that you need to do. If you're joining a little bit early, you will be more familiarized about how to answer the question. So when you attend the live lecture, same like written, right? When you attend the live lecture, you can able to participate. And attending the live lecture for this exam is very important because you have to speak, right? So we are having like more than 20 classes. So if you get an opportunity to speak, we can able to, provide you feedback about like, no, you have to speak like this way, and then we can check, we can go and correct you. And we can able to know like what's your strength and weaknesses if you are attending the live lecture and participate in the live lecture. So I insist join a little bit earlier than once the live lecture will start, and get familiarized. And if you're completely fine speaking, then it's might be a little bit easier for you. But there are a lot of students, they are not comfortable with speaking. They know everything is here, but when it comes to the speaking, it's kind of a little bit difficult, right? I don't know how to organize my answer. I know the stuff, but I don't know how to say it, right? There are a lot of students, they have the similar problem. So I would say 3 month intense practice. And if you are working full time, join a little bit earlier, okay? So then it will be no problem. You don't need to rush or stressed out anything. So don't keep it for the last moment. Can I work full time while preparing OCE? Now, once you're registered resident physio, you're earning good, right? And we have bills to pay. So there are a lot of students, they have to work, they have to send money back home as well. So they have responsibilities. So a lot of students need to work full time, like 40 hours per week, right? So yes, you can work full time, but see, if you have a lot of responsibility at home, like after work you have to do like a lot of stuff and you're not getting time for study, I would say just work like a little bit less, like keep at least 1 or 2 days for the study. But if you have to work and you have to manage, right, time management is very important. Don't keep it for the last moment. So weekend you can still practice. And there are a lot of students that they are always working full time and they can able to pass OCE. What generally they do, they'll talk to the manager like, hey, I'm going for my March exam, I might need like 2 weeks off before my exam. So just, if you are planning for work, let them know in the beginning, well, let them know when you are even joining that I might need this time off, then they will be fine. So if you are explaining them early, then it will be not issue later on. Okay, let's go back to chat box. You guys are comfortable in chat box, right? Hmm. How many attempts do we have for clinical exam? 3 attempts. But try to do in first attempt, because Nidhi, you don't want to lose this attempt. When you fail in OC, you will not, like, your resident level will go too, right? You can work as a PTA after that. So work hard, and the goal is clear in first attempt. So keep that in your mind. I have only 1 attempt, but actually you will have 3 attempts. Is there any expiration date for resident PT? Yes, within 5 years, I think you have to appear for OCE, right? So within 5 years, if you lose all 3 attempts, or within 5 years, if you are not taking any exam, then you have to give the written exam again. Do we need a study partner for preparation? Yes, you will definitely need a study partner because you need to speak, right? You have to practice, you have to judge each other. So that's a correct practice for this exam, practicing with the study partner. I have seen a lot of students, they are not comfortable with practicing study partner, and even they know everything, they're not able to pass this exam because it's completely, different exam. You have to speak in front of the people. So you need to find correct study partner is challenge for this exam, right? So once you join for the course, there are a lot of people going for the same time. So you can communicate and talk to them and find your study partner. So that's good thing. No, there is no pass or percentage wise. There is a domain. right? There are 5 or 6 domains that you have to pass, like physiotherapy expertise domain. So they will check whether you have all the skills to be a registered physiotherapist. Another domain is communication skill. Do you have appropriate communication skill? Another domain is like a collaboration. And do you have any like appropriate skill of collab to the other healthcare profession? So you have to pass each and every domain, right? There is no percentage, there is no score even, just pass or fail. If you fail even like one domain, you will fail the exam. The whole exam you have to give it again. So there is a domain that you have to pass. But they will give you score report end of the, like they will give you score report and they'll let you know in which domain you are lacking. So we can work on that, right? So they will tell you. If you are working along with preparation, then is 3 months okay? Yes, that's okay, 3 months, but then you have to be dedicated. Like it's not like this week you prepare and then next week you are not preparing, right? So dedicated 3 months is important. Consistency is important, guys, right? So at least if you are attending live lectures, right? 6 week live lecture will be there and 6 week the mentorship, and in between you will be giving your mock exam. So those are the time frame that you have to work. But you need to be dedicated and consistent with your practice for those 3 months. How many hours per day is required for preparation? I would say if your basic is clear, at least 2 to 3 hours. And because this exam is 3 hour long, I want you to build up that endurance of talking 3 hours, right? So I would say minimum 3 hours you have to practice. So like earlier it's fine if you just do like 2 hours or 3 hours. But later on you have to practice speaking for at least 3 hours. Right. And you are also practicing with your study partner. So they need to speak 3 hours too. So it's kind of a little bit tricky. How many hours? Like then some students, it depends on student to student too, right? Like, but try to use that smartly, that 3 or 4 hours that you have, right? If I join you from December when my OC exam date is not decided yet. Yeah, that's fine. If you still under, it will take 4 weeks anyways to, get your exam date and all that. Right now, March is booked up. You might get May, right? So you can still join December batch, which is 12th December. We are starting our new batch. It's good to start early. You can, if you're joining early, you can attend even like 2 batches for live lectures, right? That's even better. Because again, we don't want to lose this. We have only one attempt, remember that. So yes, you can join the December, and if you don't have your exam date. Another thing, guys, if you are registered right now and if you get May exam date for May, okay? Now, for example, you're not ready for May exam, for example, you can reschedule once. You can change the date. I don't want May. I want later, okay? Or if you want earlier, you can keep your name in a waiting list. So once the early spot is available, they will email you like, hey, March is available. Do you want to switch from May to March? Then you can go ahead. So those are 2 options. So you'll not have choice to choose the date, but you have choice to reschedule or prepone your exam. So that's a little bit flexibility you have. No, you don't need to pay more. As I say, like if you are attending, if you are pay for December, your access will be there for next year, December, right? And definitely with a 1 year time frame, you will definitely pass your OC exam. If not, a little bit here and there, something happened, will definitely, you can talk to the mentors or we can able to help you to stay a little bit longer. But most likely everybody will clear in one year. So you no need to pay any extra. You can join early and start preparation. All the lectures will be recorded. So initially you can also do, if you don't want to attend live, you can watch recordings first, and then next session next batch you can start attending live. Can we work as a resident in other province if we fail in Ontario clinical, like where there is no clinical exam? Yeah, there are certain province, like Saskatchewan, or I forget the province name. So there you can still work to a certain time frame, but to be a fully registered physiotherapist, you need to give the clinical exam for any province, right? But there is a time limit that you can work as a resident physio. But I think every province have a clinical exam now. If you don't have a clinical exam, but still you need to have some kind of hours of work that you have to do, and then there will be like an interview, like small interview based exam, right? In Alberta, we have 2 attempts or 2 years only. So after 2 attempts in Alberta, can someone give OC? Yes. Yeah, for sure. So not sure about 2 attempts, but we have a students. I think I have a student who did that's his last attempt, and he did 2 attempts in Alberta. I'll confirm and let you know, Srijana. Okay, you can contact me later on for that. That's a good question. But I definitely know, like, if you fail in Alberta, you can give exam in OC after that. Yeah. And total 3 attempts is counted. Alberta has only 2 attempts? I don't think so. They have 3 attempts. 2 attempts or 2 year only. What are the success rate generally in a first attempt? For if I say our class, we are teaching since last, like when the OC start, right? So after like dedicated students who participate in live classes, they take mentorship and MOOC, 98% ratio, like generally they all pass the exam. Only maybe 2% who are like, not dedicated, not listening to the mentors, and their personal reason maybe. So it's a high number. It's a high success rate, especially in our classes, I would say. If you have proper guidance and proper practice, it's you can able to do it. How is the mock exam like? Okay. So mock exam. So what we are offering, unlike the other prep course, our mock is 3 hour long mock exam, like complete. We are providing the complete mock exam, which include part one and part two, part one, 2 week questions, and part two, all the 11 Vignet questions. However, the other prep course, like they are not providing all the 11 Vignet questions. You'll not get like a feel and intensity of the actual exam, right? So our mock exam is very effective, and if you can go and check our Insta Live success story, and they all students recommend of taking all 3 mock exam will prepare you well. And we have organized all 3 mock exams such a way that it includes everything, all topics of ethics that you need to know, and maximum all topics of part one that you need to know. So it's a good practice if you take all 3 exam. That's what our student recommend and we recommend as well. But at least I would say take 1 or 2 mock exam before your actual exam. So the benefit of taking mock exam is you will feel the intensity and how exhausting the exam is, like speaking 3 hours, right? You will reduce your endurance after part one. So you need that practice of speaking, processing your brain for 3 hours. You will learn time management. Definitely first MOOC will be worst if you are giving first time. So we'll learn a lot of mistakes. You will learn from your mistakes. So I want you to do mistakes in a MOOC, not in your actual exam. So same mock exam will be live, like this, similar that how your OC is. It's an online exam. Once you done the whole exam, we'll give you structure or feedback at the end of the exam, not in between, right? So there are like uh, coaching classes, they give like in between. So you'll when you get like a review in between after your answer, you will not get the intensity and feel of the exam. So once the complete 3 hour exam will done, we'll give you 1 hour or intense feedback at the end of the mock exam. Also, we are providing recordings for your mock exam. So you can go again and watch. Once you listen your own answer, you can able to improve by yourself too. So that's another good advantage of our mock exam. You will get the recordings as well. Okay. Do we have external examiners or are you doing the examine? Oh, we have well-trained, experienced examiners who will be going to conduct your mock exam. Yeah. So don't worry about that. You will be assessed by the perfect person. We were taking mock exam before, but then now we are focusing more on teaching and doing mentorship and preparing you for the exam. So we have well-trained and experienced mock examiners for you. Fee for the course, I'm going to discuss in a minute. Should we give them any specific reason for changing? Yeah, they will ask like, there might be like, portal, like why you need to change the date. Like, then you can just give some reasons. That's not a big deal. Oh yeah, there is a 2 attempts only. So you need to be careful. So that's another advantage of going for OCE exam, right? You have 3 attempts for OCE. Sajan, yeah, I think I answered that. After clearing PCE, you have 5 years to clear your OCE. So you can work as a resident PT, but the thing is you have to register for OCE exam before you start working as a resident PT, right? And then you have 5 years to pass the exam in 3 attempts, but just keep in your mind, you have only 1 attempt. What's your fee structure? I'm going to discuss it right now. So I answer all the questions so far. So let's go ahead. Okay, any more questions or questions done? Any more question, guys? You can also switch on the camera and ask me. Like I want to see your faces. Don't worry. It will be fine. Just Sukhvinder.
Hi, Vrunda. Can
Hi.
you see me?
Yes, I can.
Yeah. So I wanted to ask, like you said, you guys provide the videos of the mock exams too. So you guys have a separate website or a app in which
We
we can
are
access all the
conducting mock
things?
exam on Zoom link.
Zoom. Okay,
Yeah.
so we'll be having all the videos on Zoom after the mock exam.
So if you are taking your mock exam, if you are then once you're done with your mock exam, we'll send you your own performance. So we'll
Okay,
email you. So it will be
okay.
only personalized, yeah.
And rest of the everything like the material will be on the website.
So yes, that's a good question. I'm going to discuss that. So all the material, we don't have website yet. We are working for our website. So with
Mhm.
for OCE, all the recorded lectures will be on Facebook. Like in a written, if you take, did you take written class from
Yeah,
Ankit?
from Mayank
Yeah.
sir. Yeah.
So same as the Mayank sir classes, like so we have our Facebook group. So once you enroll, we add you in our WhatsApp group and Facebook group. So in the Facebook group, we have all the previous recorded classes plus the latest one as well. Um, we're going to email you live document for our, we have a constructive cases that we have prepared with the answer key. So, you can practice that. So those are the another separate material that you need to read. We don't have like the basic, like what are the, red flags and all that detail. It's the same that you have read for written. What you need is case study. Now we have to practice as a case study. So we have provided a lot of questions, practice questions for part 1 and part 2 in a case study format with the answer key. So that will be there. Yeah, what else? Mentorship classes will not record it because we want you to be there, right? So when you come at the mentorship level, we want you to be there to prepare, because at that level you will be quite well prepared, but we still need to polish some skills and all that. So mentorship is not provided, recordings is not provided for mentorship classes, but mock will be recorded, only your performance, and it will be sending to you only, and all the
And
classes will be there in recorded as well.
okay, all the other classes will be recorded.
Yes.
Okay. And what will be the timing of the mentorship classes? It will be like after
Mostly
8 p.m.
all
or
the
something like that.
classes we try to keep it like evening because everybody is working, right? So 8 p.m. will be the mostly the classes time. Even like a mentorship class or regular classes will be the 8 p.m. Even the mock also we try to keep it evening, or if we are keeping weekend, it might be morning. But most
Mhm.
likely we'll try to keep evening so everybody can join and work at the same time.
Okay, and we'll have to pay separately for the mentorship classes,
Yeah, the
just like the
payment
PCs.
I will discuss about the payments in a minute because I have slides, so it will be there.
Okay,
Okay,
all right. Thank you so much.
you're welcome. Any other question, guys? Yes, fee structure I'm going to discuss. If we don't pass in first attempt, then do we have to give written exam again? No. So if you failed your first attempt for OCE, you have to give second attempt for OCE, but you cannot work as a resident PT. So you will lose your status as a resident PT. You can work as a PTA in Ontario. Okay. Is your content enough for the preparation? Yes, the content what we are providing is enough for the preparation. Do we need to do any extra reading from your end? Like you just need to know like your basic concept, right? Whatever you read for written, you that what you need to know. Plus a little bit a little bit different, like because it's a clinical practice, so maybe more clinical scenario and ethical issues and dilemma are there. So you might need to read a little bit, but not too much that what you read for written, right? So the same thing should be there. Like if you have basic concept clear, it will be easier and there is no lot of extra reading for you. Okay. Any more question, guys? You can raise your hand, switch on the camera, and then we can discuss.
Hello. Hi, Vrunda.
Hi, Diva. How are you?
I'm
Dibash,
good,
right?
good.
Am I
Yes,
pronouncing
yes.
your name correct? Okay.
Yeah, yeah, you're correct. I want to know, actually, I have typed my question. If anyone
Hmm.
fails OC, let's say, so
Hmm.
in Ontario, they're no longer eligible to work as resident PT, right? But
Yes.
can they go to other provinces where there is no clinicals if they fail,
Which province they have no clinical?
like Saskatchewan, Nova Scotia, Manitoba?
I think they have, yeah, that's the option is there, but still, there are some criteria to work as a, from as a resident PT to registered PT. You need to work, right? Certain hours and all. So, yes, a lot of students are doing that. They move the other province and they can still work as a resident PT. But yes, they have 1,200 hours to finish and then they will assess your work and evaluate. And again, you have to give a kind of interview
Interview. Yeah, yeah.
interview, right? After 1,200 hours, they will check your soap notes. They will pick random cases from your own work. And then they will ask you the same thing, like what's your assessment criteria, what's your discharge criteria. So looks like it's kind of similar exam then that OC is taking, plus you have to work 1,200 hours and you have to wait, right? So that's another option. You can still earn as a resident PT going there and all that, but forget about that. Just work 3 months, you can get your resident PT. But yeah, that's the
What's
option that a
the
lot of
What's the
students
past
have.
percentage, ma'am, among the students who had taken the classes?
I said 98%. And
Okay.
tomorrow is the result date, so you can join
Oh.
our live tomorrow. Yeah. And in
Okay.
October, we have a lot of students appear for the exam. So we are expecting big result for tomorrow. Tomorrow is a result date. After tomorrow, we'll organize our Insta live in within 1 or 2 days. So that's also a good thing that you can attend and all the success story, then you can listen from them. So far, it's like 98% result is there. So if you are not like, there are students who fail because it's misguided. They eat from everywhere and they're not able to digest, right? So eat only as much as you can digest and don't get confused, because there are a lot of stuff going on. Now a lot of work people also started providing mentorship, and it's kind of confusing. So if you are going everywhere and get yourself confused, then you will go confused during the exam and then messed up. So if you are kind of very clear about your answer, straightforward answer, then it's easy to pass. So try not to be confuse yourself, I would say that, and that will going to help.
Ma'am, do you know?
Yeah, go ahead. You're mute, Dibash.
Hello.
Yeah, now
Am I
now
audible?
now
Yeah.
you're audible.
Yes, yes, ma'am. So, do you have any information about other provinces as well, ma'am? So, for someone, we are not in Canada, ma'am. Okay. So the
Okay.
process is to apply for a job in Canada. First of all, we have to register for OC, correct, ma'am? So the
Yes.
next available OC is in the, I think, in the in the
May
month of
right
May.
now. Hmm.
Just in case, ma'am. Okay, let's say we book for OC, right? And we start our let's say we get our job offer or whatever, LMIA and all. So that
Hmm.
process will start, right? And if
Yes.
we fail, okay, if we fail, so everything, the process stops over there, right? Because
Yes,
they will
yes.
cancel our resident PT license.
No.
So see, there's a I feel there's a uh
But
bit of more risk.
it's a
Uh,
risk. So
and
what happened is, if you apply for as a if you're as a student and in LMI after resident PT, you have to upload all that document. So you can still work as a resident PT. So work as a resident, come work as a resident PT, and then prepare. It's rules is for everybody, even citizen person or permanent resident. If you fail, you will lose your resident license, right? But if you are coming here only on work visa, and if you don't have work, then it gone, right? So that's the thing. But you can work as a PTA, which is
no,
a lot of
they won't
less, but you
let
don't
us
want
to
you
they
don't
won't
want
let
that.
us to enter the country, ma'am. So everything will be cancelled, right?
You pass your
Because-
written exam,
Yeah, I have passed.
so you cannot come as a resident physio. They can hire you as a resident physio.
No, if I fail my clinicals, right, the
Hmm.
process which I'll start with LMIA and work permit, that
Yeah.
process will be cancelled if I fail
Yes.
clinical, isn't it?
Yeah.
So
That's
you
true.
guys, you guys do not provide mentorship for Alberta. I'm feeling Alberta is a bit safer because it gives that window, the time, right? At least LMI and everything will be approved, work
Hmm.
permit will be approved. If we fail, also still will be in Canada first of all, and we can search
So
for alternative.
for LMI, I have not like not much idea, but for LMI, you need to have full registered physio. You cannot apply as a resident physio
No,
because you can work.
they do provide LMIA for resident PTs as well now.
So come as a resident PT. Once you come over
No, no.
here, then give
See,
your OC. Don't give OC in a hurry. Then if you have
I I checked the conditions, ma'am, about to postpone our OC exam. I feel they are a bit strict.
So, see, once you get your May, right, you have still one chance to reschedule. So you can give some reasons. Yeah, you need to give
Mhm.
like real solid reasons to reschedule, maybe a few more months later. But at least if you
Okay.
prepare well, and then I think you will be fine. So think about positive stuff from today. So think more about positive. What if you are pass and that
Yeah,
way? But
the
I know
risk
it's our
involved with
human nature.
risk too much.
We
Yeah,
always
yeah.
think about what if, right?
That's my ma'am. That's why I was calculating the risk and all. So I'm
Right,
feeling,
right,
maybe other provinces safe and parallelly I could prepare for OC as well. But
right,
as you
right.
said, the pass percent is almost 98, which is good news, ma'am. So I was actually
Yeah, it's
looking for
much
that.
manageable. It's because exam stress will be reduced as you are comfortably sitting in your own home, right? You don't need to travel for the exam. It's not like a different environment. So a lot of exam stress and anxiety will reduce because it's in person, in-home exam. You don't need to go anywhere. You don't need to travel. You can give exam from your home country. That's another advantage, right? So that way, and you can still do, because exam is online, you can prepare and study online, right? So if you are giving good time, 3 to 4 months dedicated, you will be passed. And if you have like basic concept clear, you are a student of
Okay.
PC written.
Yes, study
Yeah,
buddy. Yes.
StudyBuddy. Yeah, then you will be fine. Don't worry.
Thank you. Thank you, ma'am.
Yeah. Srijana is saying, if fail, losing resident license is only for Ontario or Alberta. Also, it's you will lose resident for all the province that is offering clinical exam. As we discussed, like there are certain province there is no clinical exam. You can go there and work, but I don't think so. That's a good idea, right? You want to stay in bright Ontario, maybe. We have still sunshine. Yes, it's cold, but it's a sunshine place. So yes. So if you fail resident, if you fail OC for Ontario, you cannot work as a resident in Alberta. Okay. Any more question, guys? So far it's going amazing. Thanks for participating. If you have any question, you can switch on camera, or if you're not comfortable, just unmute your mic and then raise your hand, okay? So now I'll talk about what we are offering. So from December 12th, our next batch will be started. And then we have total 20 classes. Each class will be more than 2 hours long. It will be discussion and more case study based classes that actually what you need to prepare for your Ontario clinical exam. So we'll teach you, we'll display the cases, we're going to discuss how you have to answer, right? Including 2 strategy class that will be taken by Ankit sir. Lot of strategies that are going to help you avoid mistake, do's and don'ts. Class recording will be available, but we recommend closer to the exam, we recommend you to attend more live lectures. We have comprehensive, really good notes, which includes a lot of case studies, maybe 50, 60 case studies with the answer keys. Then we have 3 mock exams, which structure such a way that when you give all 3 exams, you are completely prepared for it. Like all the topics and questions are selected. Then we have mentorship classes. We have 3 mentors, myself, Mehul, and Radhika. Mentorship classes is total 6 classes will be there for the mentorship. Once you're done with your live classes, then the mentorship class it's kind of extra help for the students who think they still need, one-on-one attention and more closer assessment. Because in a big class, when you are learning and in an early phase, we don't prompt you and we don't scold you too much, but once you are in the mentorship classes, we can able to catch your small mistake and polish your skill and more sharpened. So as a similar, like in a written, you all know about how mentorship goes, right? So similar way, we have 6 intense classes to improve your skills and performance. Your weakness we can check, and then more chances to pass the exam. Fee structure. So course fee is $999. If you are enrolling in a group, for example, if you have a group of 5 students, so each student will get $100 discount. If you have 10 students group, then each student will get $150 discount. So group enrollment has a little bit discount price, but if you don't have a group and if you're enrolling alone, that's 999 Canadian dollar. Okay. 1 year access, okay, for recorded classes and notes. MOOC exam, it's not included in a course exam. It's a separate exam. We have hired very skilled examiners, so it's MOOC exam is worth paying. So one MOOC exam price is $349. This price is applicable from like 15th December, right? So if you are enrolling after that. This is the price. One mock exam, $349. And if you are taking all 3 mock exams, that's a discount price. $949 for all 3 mock exams. Mentorship fee is $399, which is also separate. So mentorship fee will go to the mentors. Mock and course fee, it will be on the PCE StudyBuddy Clinical. So how you can pay? So for the class enrollment, you can start with the course enrollment first, okay? And then later on, you can choose your mentor, whoever you are comfortable with. So you can choose your mentor later on. This is the contact number that you can reach out to us. My number, Mehul, and Radhika's number is there. You can reach out to anybody if you have more questions about what we are offering other than this. So those are the 3 mentors. And then you can make e-transfer to pcsstudybuddyclinical@gmail.com to enroll for the course. Okay. MOOC and course fee, you can e-transfer to this email. And for mentorship, you can reach out to the particular mentor and ask them for how you can pay for that. But I recommend just join the course, learn, and then choose your mentor later on. Okay. Yes, so our next batch for the March, we are starting from 12th December. That's our next live class will be. Currently, we are almost done for the January exam people, and then our mentorship for January will be start. So mentorship will start maybe 7 weeks before your exam. We are not starting earlier. You still practice, learn, and once you join the mentorship, we want you to be a little bit, like, at least 40-60% ready. Then rest we can, make you more than 100% once you have a mentorship. Any more question, guys? Yes, I'm in Ontario in Durham region, actually. Any question, guys? Any burning question? I think it was a good discussion. So reach out to us, okay, for any questions still you have. If you are not comfortable asking here, you can reach out any of us. Then we can able to help you for enrollment, or if you have any still confusion or anything. One more question there. Pricing slide, okay. So course fee, $999. Group discount, 5 student, 10 student. So when you enroll with a group, if you are enrolling with the group, we want that 5 name, okay? So don't just say we are still looking for the group. So if you are enrolling for the group, come with that 5 name. We have installment policy as well. So if you want to pay half price, you can pay after 4 weeks. So that's another option. Fourth slide. This one, Tanvi? Okay. So when you go to the PT portal, this will open. And then here there's a 3 option: OC application, practice assessment, or OC result. So you can go to the OC application. When you click there, you will get this. You will have your own profile, and then you need to follow the registration information. So you all need to register for PT portal, guys, first of all. That's a mandatory. That's the mandatory, okay? So College of Physiotherapy website, you can go over here, and then there is a right-hand side, there's a PT portal. Click there. If you didn't register first. If you're registered, then you can sign in and go to this page and finish with your application form. Once the application is done, they will give you step-by-step everything. It will be well informed and guided, so you'll not get confused with anything. Okay, guys, thank you so much for joining today. If you have any question, you can still reach out to us. This is information. You can take a screenshot if you like, right? And then join our orientation class, which will be free on 12th December to know more about OCE and what we are offering again. That will be a good opportunity. In between, tomorrow is a big day. A result will be out. So also join our Insta lives to learn more about how student learning from the student is most easy way, right? What strategy worked for them, same like a written. So you will have 2 more opportunity to learn more about OCE. And if you have still question, number is here. Okay, guys. Thank you so much for joining. Good night, everyone.